Good afternoon. I'm Dr. Michael Toney, Executive Director of the Urban Health Program at the University of Illinois at Chicago, and you are watching the Urban Health Hotline. Every week now, for the next several weeks, you'll have an opportunity to call in to have your questions answered regarding educational options at the University of Illinois, particularly in the health sciences. You have an opportunity to call in. We'll have some very interesting, dynamic guests to talk about issues that have an impact on our community, particularly as it pertains to health disparities and healthcare generally. Remember, this is a call-in show. It's your show. Whenever you have a question, we would encourage you to call in and discuss it with our panelists. We'll do everything that we can to have you on the air with us, so please call in. You can call in now, in fact. The number is listed at the bottom of the screen, area code 312-738-1060. You can call in now. The phone lines are open. I'm joined today by someone that you will find very interesting, someone that you will find very knowledgeable. Miss Adrienne White is the Vice President of Health Initiatives and Advocacy of the Illinois Division of the American Cancer Society. Recently, the Urban Health Program began a partnership with Adrienne's office on some very important projects that could have an important benefit for our community. A little later, you'll have an opportunity to talk with some UHP students that will be working with Adrienne's office in implementing the project. And so with that, I'd like to thank Adrienne for joining us today.
My pleasure.
Let's start off by asking you a little bit about the American Cancer Society in generally and some of the work that you're doing here in the Chicagoland area.
Thank you very much. Thank you for having us. We love the opportunity to try to share with individuals more about the American Cancer Society, but also about the importance of fighting and preventing cancer. The American Cancer Society in Illinois actually works to get rid of and fight cancer through prevention, through education, educating people about cancer, as well as through public policy change and advocacy, and through patient services, helping those who need help who are diagnosed with cancer. So it's many, many, many programs and initiatives across the state of Illinois as we fight to make sure that more people understand how to prevent it and fewer people are diagnosed with the disease.
Very good. At the Urban Health Program, we have as a mission to increase the number of underrepresented students in the health professions. We work very closely with 6 colleges, health science colleges, the College of Medicine, Dentistry, Pharmacy, I mentioned dentistry, Applied Health Sciences, the Graduate College, and a few others. But our major focus is to address and eradicate healthcare disparities. And to that end, we know that your office is on the forefront of that issue as well, particularly as it pertains to Black and Latino students. Could you share with us a little bit about how cancer fits into that whole discussion of healthcare disparities as it pertains to people of color?
Sure, sure. Dr. Toney, it's really one of the key reasons why we partner with organizations like the Urban Health Program at UIC, because when you are dealing with disparities or cancer disparities, looking at different diseases that affect different populations because of issues such as race or socioeconomic status or education levels, it takes a very systematic approach. No single organization can do this alone. But also the talents of individuals that are needed to actually do work in this area really takes a very complex approach. So that's why the UIC program is so important to us. But how it impacts cancer is that the reality is there are cancer impacts various populations based on their race. It's based on geography, your access to services. It's based on your ability, an individual's ability to get information and understand about resources. And as we know in the United States, not all populations have access to the same services and resources and information. And therein lies many, many years of challenges, and therefore such diseases begin to impact different populations differently. And finally, when it comes to chronic diseases like cancer, there's also the issue of genetics and family history. So when you take family history, societal issues, cultural issues, access to care and genetics, you put it all together, and you begin to have unequal impact on different populations.
Absolutely. Are there some cancers that adversely impact African American and Latino communities more so than others?
Yes, well, the important thing to remember, first of all, is that cancer is more than one disease. Cancer is actually 150 different diseases. And so we often think about those cancers that we hear about most often: lung cancer, breast cancer, prostate, colorectal cancer. Those four alone make up for 60% of all the cancers diagnosed. And yes, when you look at those cancers, unfortunately, they are African Americans are at higher risk for those cancers than all others, and the Hispanic population is at higher risk for all of those cancers as well. But the challenge is that you end up with any type of cancer if you have barriers to care, or if you do not understand how to access care, or you go to treatment later. There are things that are with cultural activities within the African American and Hispanic population that keep us from being able to access services in a timely manner. And those impact on all the 150 different cancers. And so, like other chronic diseases, you end up as a result where those populations actually die of the disease when oftentimes it's preventable. And that's what the travesty is, and that's what we have to start to work on.
So a tremendous amount depends on educating individuals so that they
Absolutely.
could be more proactive and to prevent the spread of the disease. I'd like to remind our viewers that you're watching the UIC Urban Health Hotline, and the phones are open. Please call in if you have any questions. Our guest today is Miss Adrienne White, who is the Vice President for Health Care Initiatives and Advocacy for the American Cancer Society Illinois Division. One reason that we asked Ms. White to be here today was because of a special partnership that we've developed with her office pertaining to providing screening for mammography and colorectal cancer. Could you tell us a little bit about that project, please?
Sure, we're so excited about this program because, as you've pointed out, in many underserved communities, minority communities, those that do not have access to insurance, they are not able to receive the same screening and treatment that many others in the population might be able to receive. And so we're working with UIC along with Cook County Stroger Hospital to see what we can do to make sure that anyone who desires or is at the age where they need breast cancer screening or colorectal screening actually can receive those services in a timely fashion, as well as receive more information about the importance of having such screening.
We have a caller here. Caller, you have a question for Mrs. White? Hello, caller, you're on the air.
Hello?
Hello.
Hello?
Yes, you're
yes,
on the air.
I'd like to know for those people who are indigent, who don't have insurance, and who want to or are aware of the fact that early detection is important, what kind of avenues would they have for trying to make sure that they get screened for, let's say, colon cancer or breast cancer, and how, if there are programs? My second question is, how long does it take for the American Cancer Society to develop and set up those programs in order to get access for people who don't necessarily have resources?
Well, we do know that for many poor and indigent people, the primary place that they go for health care oftentimes is Stroger Hospital. And we oftentimes talk to individuals in the emergency room who tells us that if it weren't for the emergency room visits, they would not oftentimes have access to medical attention at all. And so that's one reason, I'm sure, why we're offering this program there to launch it there at Stroger. But Ms. White?
Well, yes, and fortunately, in the state of Illinois, for breast cancer, everyone can actually get access to breast cancer screening because of a system approach which is available through the state called Illinois Breast and Cervical Cancer Program. What this program does is it helps people who are not insured to be able to go and get a mammogram at any hospital or institution or provider that actually accepts Medicaid. So that means that there are many of the ambulatory centers or outpatient clinics or the Chicago Department of Public Health. But again, much of the problem exists because people are not aware that the program exists. So if you are 40 years old and or older and need to have a mammogram, and you need to have a mammogram once a year if you're 40 years or older, and you do not have insurance, you can contact the Illinois Breast and Cervical Cancer Program, or you can contact the American Cancer Society, and we will help you find that service. So that's the first piece. For colorectal cancer, it's a little bit more difficult, which is one of the reasons why we've set up this program. It is if you have insurance or Medicare, then you do have access to colorectal cancer screening. But it is more difficult for people who are uninsured. And so at this point in time, we encourage people who believe that they need colorectal screening or who are age 50 or older to contact the American Cancer Society so that we can help get them to the appropriate programs and services. The program that we are beginning with you all is working at Cook County Stroger Hospital to help bring education and help meet people while they're getting care to direct them to the appropriate screening now while they're actively there.
That is just so vitally important that we continue to be proactive
Absolutely.
and to provide those services early on to our population. We know that this project involves a study of some kind. And what will the study tell us ultimately? What is your grandest hope in terms of outcomes?
Well, the beauty of this study or the program that we're doing with UIC and Cook County Stroger is that it's not as much a study as it is to bring a service to the community. We actually are working to bring people who are uninsured to colorectal screening and breast cancer screening in a timely fashion. In the meantime, those who participate help us to understand what types of colorectal screening people prefer. Many are not aware that there's many different types of colorectal screening. There's colonoscopies, there's fecal occult tests, there are what are called sigmoidoscopies, but the opportunity is to educate people about why colorectal screening is important, help them make decisions, but then in addition to providing the screening to the individuals, you can go back home and in your communities and tell others. There's nothing more positive than someone who has been screened to share with others, it's okay, it's important to do, we have to embrace our health.
And that's exactly what I think is needed. That's where the rubber hits the road. As we're beginning to educate our community, it spreads like wildfire, and that's exactly what's needed. So tell me, how are our students working out with you in the project, the Urban Health Program students?
Absolutely fabulous.
Wonderful.
Absolutely fabulous. What's exciting about the students from the UIC Urban Health Program is that they come in understanding that the patients oftentimes have complex issues, that they may be coming for health care, but they also are coming from environments that they're carrying other loads on their mind, other priorities, and the ability to understand that you can't help someone through their health care issues without looking at their global circumstance. And so the beauty of the program is that we're working with students that appreciate and bring diverse perspective themselves to work with this population that has diverse issues. It's a wonderful partnership, and I'm sure it will be very successful.
Well, again, we want to thank you for joining us today.
My pleasure.
Adrienne, has been really wonderful. We want you to come back at the end of the project to provide our listeners and our viewers with an update. I'm sure that they will find it very informative as they have today as well.
I look forward to it.
So thank you.
Thank you.